Hi everybody, and in this video we're going to demonstrate a high velocity, low amplitude thrust known as the lift-off adjustment for the CDJ cervical dorsal junction, but can also be used for T1 down as far as T4. Now in this case the patient is smaller in stature than the practitioner, so it's appropriate to use the standing lift-off technique, but if you have the opposite balance where the patient is larger than the practitioner, you may also use this in a seated position. So to move forward with this technique, we generally use some type of a block barrier like a rolled towel. A hand towel will work just fine as well. This is a small towel, thin towel, which works quite effectively. So we're looking for the T1 to T4 area. So for example, T3, if we look at the superior border or angle of the scapula is roughly T3, moving down one level from there and block at T4. Okay, so what we do is apply our chest to the barrier. We ask the patient to place their hands on top of their head. So this is one particular hold. There are multiple holds. I would then place my hands at the back of the patient's neck, interlocking my fingers. I then ask the patient to place their hands on top of mine. And then I would ask the patient to lightly squeeze their elbows. So some people say look down, some people say look up. I prefer the look up technique. That helps me lock and secure their neck without putting excessive force through their neck, as we're localizing to T1 to T4. I then will use my rear foot to stand back on so that I'm not putting my own back at risk as I traction the patient in an upwards fashion. Now what I need to find is the restrictive barriers to thrust through. So I will bring the patient back. We need to be quick doing this. So you can side bend, rotate, flex or extend at the segment, but you can collect all the barriers at the same time as needed. So what I do is a slight auscultation. So squeeze your elbows, look up to the ceiling, and as I traction back, it's an upwards movement once we block the barriers and thrust. And there we have it guys, a nice simple lift up CDJ high velocity, low amplitude thrust for the upper thoracic.